Back in April, the Heart Hospital of New Mexico at Lovelace Medical Center celebrated the first anniversary of the Cardiogenic Shock program, which is the only one of its kind in New Mexico. So what exactly is cardiogenic shock? Well, we're joined this morning by interventional cardiologist Dr. Raymond Yao, finding out more about what cardiogenic shock is and how the Heart Hospital of New Mexico's cardiogenic shock program works. Good morning.
Good morning.
Welcome. Doctor, we were talking a little bit about this in the break. I said cardiogenic shock sounds kind of scary, and you explained that it is scary. What is cardiogenic shock?
So cardiogenic shock is a life-threatening condition where your heart is in a state and it's unable to pump blood and oxygen to your organs, meaning your brain, your kidneys, and your liver. If not treated emergently, your chances of survival are really low. But however, if you're going to a hospital and you're in cardiogenic shock, especially the Heart Hospital, we have a program where there's rapid identification that you're in cardiogenic shock and you get treated emergently by our cardiogenic shock team.
And you were also telling me in the break that a lot of times cardiogenic shock is hard to identify.
Yes. The traditional diagnosis of cardiogenic shock is having a low blood pressure, but what's really difficult in the hospital setting is that many people who have a heart attack or have heart problems don't seek care emergently and they wait a little too long. That's why I strongly encourage, if you think you have a heart condition, call 911 immediately. We have one of the best emergency medical services around the country. They are very well trained to identify heart attacks and heart problems.
So does the new cardiogenic shock program help to identify cardiogenic shock a little bit easier than before?
Yes, because we actually have protocols now that everyone abides by. So whether you get Dr. A or Dr. B or Nurse B, you're all treated the same. Okay. So this has been very instrumental in helping us sustain our cardiogenic shock program.
How do physicians treat patients that are dealing with cardiogenic shock?
So in the most severe forms of cardiogenic shock, we use heart-lung machines. We actually put a person and put a heart pump in their heart, and it helps provide blood flow to the brain and the organs. And
you mentioned it, but you said that this is something that needs to be treated urgently. How urgently are we talking?
We say in cardiology, time is muscle. Okay. So every minute that you lose, or actually 15 minutes you lose, your chances of survival go down by 3%.
Wow. So if somebody feels like they may have some sort of heart condition,
yes,
get seen right away.
Absolutely.
All right, doctor, where can we go for a little bit more information on the cardiogenic shock program?
You could log on to the Lovelace website at lovelace.com and type up cardiogenic shock, and there'll be more information on it. But once again, if you're thinking that you're having a heart condition, please call 911.
Perfect. Thanks again so much for being here with us this morning. For more information on this entire interview, you can also head to our website. That's always on krqe.com. Stay with us. Your headlines and weather are up next.